Welcome to the Health Channel, all health, all the time. I'm Henry Guzman, a registered nurse and exercise physiologist with Baptist Health South Florida. On our Healthy Living show, we're talking about influenza. 100 years ago, the 1918 influenza pandemic devastated entire communities and took an estimated 675,000 American lives. Last year, the Centers for Disease Control and Prevention reported 80,000 deaths from the flu. No comparison to the 1918 pandemic, where over 50 million people worldwide lost their lives. But influenza continues to pose a unique public health challenge as viruses are constantly changing. With us to break down influenza is Elizabeth Reinhardt, an advanced registered nurse practitioner with Baptist Hospital. Welcome to the show, Liz.
Thank you.
Unlike the 1918 influenza outbreak, the flu is now preventable, thanks to vaccines. Liz, while we're on the topic of histories, how did people treat influenza back in 1918?
Well, back in 1918, there was no vaccine, so there was doctors would prescribe whiskey, or they might ask you to smoke a cigar.
Interesting. Well, an interesting story about prescribing alcohol. You know, the prohibition, as most people know, started in 1920. So if you're wondering how they were able to prescribe whiskey, back then it was a few distilleries actually got some licenses so they can continue to use alcohol for medicinal purposes. But that's fascinating that they're
yeah, they
using it
even
back
would
then.
ask you to gargle with some water and salt, or sometimes they would also cut the thoracic cavity or the chest to drain the pus and the blood and bleed you. So
I'd imagine not too many people survive that sort of
most of them were,
procedure.
You're right. Most of them died from those procedures.
Oh boy. So where exactly did the term influenza come from?
So it's interesting because the term influenza comes from an Italian word, says influenza, meaning to influence, influenza, to influence. And it was believed, the early Europeans believed that there was an influence of the planets and the moons and the stars in the epidemic of influenza. Later on in 1743, it was adopted into an English word. At this point, it was known as a bad influence. So it was believed that the epidemic of influenza and the symptoms were caused by heretics' influence.
Interesting. So if you weren't a believer in certain religions, then you caused
the epidemic.
That's fascinating. So now we know a little bit of the history of influenza. Can you tell us, break down a little bit, what is it exactly?
So what exactly is influenza? Influenza is a serious respiratory illness. It is caused by a respiratory virus, the influenza virus. Many folks will maybe mistaking this for a cold or a catarrhal syndrome, but influenza is not a cold or a catarrhal syndrome. Influenza actually leads to death. As you know, the CDC estimated over 80,000 deaths from influenza last year. So influenza is not just a cold. It doesn't have age limit. It affects the old, over 65, the young, the pregnant, those that might have cardiac disease or pulmonary disease, those that might have cancer, the pregnant woman. All of these populations are affected by influenza.
That's fascinating because we hear these statistics a lot every year as the flu season comes around, that people actually die from this. But I don't know if it really sinks into folks that, no, this is a really serious illness that you can have that can cause death. So let's take a look at some of the symptoms. We've got a nice graphic that we're going to put up here, and maybe you can talk us through some of these symptoms.
So the most important thing to look at with influenza is that it's abrupt. The sudden symptoms occur abruptly. You will have a fever, you will have a cough, you would have sores, runny nose, stuffy nose, body aches, headache, chills. So the most important thing is that not to just mistaken influenza for a cold, but remember that a fever and chills and abruptness of these symptoms most likely are influenza.
Yeah, so well, I know I've experienced a lot of these symptoms, and sometimes it's kind of hard to tell what it is you have. How long does it take to really develop the flu?
So the influenza, within 1 to 2 days, actually you will be exposed to the influenza and be incubated. That period of incubation occurs within 1 to 4 days, and your symptoms will be 1 to 2 days before the onset. So you already are showing that you are contagious 1 to 2 days before the onset of symptoms. And from the day before the symptoms begin, that those feelings of feeling sick will be almost a week.
That's great information, because some people, when you get infected, you're not necessarily feeling the symptoms, but you could still pass them on to other folks. So you have to
exactly.
So it's kind of hard to tell, when exactly to be extra careful. So how do you know when to seek medical care exactly? The Mayo Clinic explains in this next video.
Fever, muscle aches, respiratory illness, this is pretty classic for influenza.
In what the CDC calls the worst flu season in a decade, millions of Americans will suffer through these influenza symptoms. So knowing when to see a healthcare provider and when to stay home can be tricky. Urgent care and emergency departments across the country end up flooded with patients, many of whom don't need to be there.
It makes it a lot harder for those folks who do need to be seen to get in on time.
Mayo Clinic infectious diseases specialist Dr. Pratish Tosh says babies under 12 months, people over age 65, pregnant women, and people with heart and lung diseases should definitely see a healthcare provider as soon as they show symptoms.
Most young, healthy people who develop influenza will do just fine. Staying at home, getting plenty of fluid, plenty of rest.
But even otherwise healthy people can suffer complications from influenza. Dr. Tosh says if your fever doesn't go down, you're having trouble thinking, can't keep fluids down, and you get lightheaded when you stand up, it's time to seek medical care. He also says your chances of having complications are much lower if you get a flu shot.
That's great information. So Liz, how exactly does the flu spread?
So the influenza is spread through the air by the respiratory tract. So someone who has influenza, when they sneeze or they cough or they speak, they will spread the virus of influenza.
So I've heard that the virus can actually travel about 25 to 50 miles per hour. Does that sound?
That sounds correct. Actually, there was a study done by Wake Forest University in Winston-Salem, North Carolina, that they took 61 patients to see how far does the virus, influenza, travel from those patients who had influenza when they coughed or they sneezed or they spoke. And they found that these folks would actually spread the virus 6 feet away from where they were when they coughed, when they spoke, when they sneezed.
That's amazing, because when you're around somebody who's not feeling well, you think, let me stand back a couple of feet, I'll be okay. But now you're telling us that up to 6 feet away, you still could get infected.
Definitely. More so, it could also stay on a surface. So you have influenza, I have influenza, and I touch a surface, and that will also cause the virus to contaminate that surface. In another study was actually done, they said, so how does that happen? The surface becomes contaminated, you touch the surface, and then you touch your face. So they did the study to see how long or how many times someone touched their face within an hour, and they found 16 times. So we touch our nose, we touch our mouth, we cough into our hands, we sneeze into our hands, and then we touch the surface. Actually, one interesting thing is that they felt that one digit was introduced to each nostril at least 5 times in an hour.
That's amazing. I'm learning so much now with the spreading of the flu. 6 feet away, 25, 50 miles an hour, surfaces. We actually have a caller. We have Lauren from Miami. Lauren, hello.
Hello there.
How are you?
Getting over a cold.
Okay. Lauren, what's your question?
Is there anything going to be done about airlines with confined spaces, with the cleaning of the seats, the cleaning of the television screens? I notice more and more folks are using masks when they're going on flights now. Is there anything that airlines can do mandated?
That's a great question, Lawrence. I'm going to pass that over to Liz, and I have a few ideas on that myself, but thank you for your question. So Liz, what do you think? I mean, now with knowing how much this spreads, do airlines actually take an active role in, I know they clean the planes in between, but do we really know how they're cleaning these planes?
I imagine with all the knowledge and information that's being spread about how influenza is spread and the possibility of epidemics occurring and in a closed and quarantine environment, that the airlines are putting into policies, ways of preventing influenza and taking care of those that go on air flights. So I do believe that there's probably very strict policies on cleaning and making sure that we're safe.
Yeah, that's good to know. I'm gonna think that on the websites, most of these airlines are gonna probably tell you some of that information, because you think one person gets on this flight and they can infect everybody on that flight. How many passengers can fit on one of these big planes now?
Definitely.
And round, you know, more and more people
Most
get
definitely.
infected. So an annual flu vaccination is recommended for all ages 6 months and older. Up next, Liz and I will talk about who should and who shouldn't get the vaccine. You're watching the Health Channel, All Health All the Time on South Florida PBS. If you have a question about the flu, please call in using the toll-free number, 855-796-4475. And be sure to visit allhealthtv.com, where you can watch videos from previous episodes. We'll be right back.
I was too young to get a mammogram, and I had no family history, and the lump was probably just nothing.
And I sat in that waiting room talking to women, and there were about 10 of us, and I casually joked with another woman, I can't believe that 1 in 8 women will be diagnosed in breast cancer. There are 10 of us in this room today.
Yo sabía que iba a regresar positivo.
She was fairly certain that I had breast cancer. When I heard my grandmother was sick, I knew I had to take care of her more.
I heard the 3 most horrific words anybody could ever hear. You have cancer.
They were giving me life-changing, devastating news, but at the same time, they were giving me a plan.
I felt very blessed to be here in Miami and to have a network of doctors.
Cancer treatment is ugly. The way Baptist treats you as a person is beautiful.
I just knew in my gut that I was going to be okay.
When you finish radiation, you ring a bell. Pretty much the entire staff of MCI showed up.
Your dream team is out there.
Las siento como unas personas, como amigas, más que doctores.
If I waited, I wouldn't be here today. Early detection is incredibly important. Know your body. Go and see your doctor, get the mammogram, get checked.
I can't stress enough how important it is to be your own advocate.
Early detection saved my life.
So many people helped me, and now it's my turn to give back.
There's part of myself that I had lost, and I found it after.
Mis experiencias en Miami Cancer Institute han sido muy buenas. Los tratamientos han sido sensacionales.
Miami Cancer Institute is Disney for cancer patients.
Embrace tomorrow.
Programe su mamografía hoy.
Abraza el mañana.
Schedule your mammogram today.
Hurricane Florence made a direct hit on the Carolinas, causing wind damage and widespread flooding. As the floodwaters begin to recede, Allstate mobile claim centers are canvassing the Carolinas to assist people affected by the storm.
We have mobile claim centers set up throughout the entire area so that people can come to us and they can start the paperwork. And in some cases, if they have a covered loss, we can cut them a check on the spot or deposit money into their accounts.
Learn more at allstate.com/recovery.
Welcome back to the Health Channel, All Health All the Time. I'm Henry Guzman, a registered nurse and exercise physiologist with Baptist Health South Florida. We're talking about influenza and Who should get the yearly vaccine with Elizabeth Reinhardt, an advanced registered nurse practitioner with Baptist Hospital? If you have a question on the flu, please call in using the toll-free number 855-796-4475. We would love to hear from you. Liz, we just spoke about the symptoms of influenza and how contagious it is. So should everyone get the flu shot?
So annual vaccination is recommended for anyone 6 months or older.
Okay. Any reason why 6 months is the cutoff point?
Well, it's found that children 6 months and younger are unable to develop the immunity that is needed for influenza vaccine to act and antibiotics to fight the influenza illness.
Okay, so basically everyone really should get the...
Everyone should get an influenza vaccine.
Okay. And when is the flu season? Because I know people are always worried about exactly when it starts.
In the U.S., the flu season starts in the fall, and then it goes into the late, even up to May month of spring. So the CDC recommends that you get your influenza vaccine by October, the end of October.
Okay, so end of October is the safe spot to get.
Yes, because you need 2 weeks to build immunity to the vaccine.
Okay, we actually have a nice video on the importance of flu vaccines. Let's look at it, and then we'll chat a little bit afterwards.
One quick poke in the arm could save your life, says Dr. Gregory Poland, director of Mayo Clinic's Vaccine Research Group.
Depending on the year, we'll have 3,000 to 30,000 people or more die from influenza, and that is preventable.
Dr. Poland says very young children and older adults are the ones who have the most complications from the flu.
About 90% of the deaths due to influenza occur in people 65 and older.
This year, 2 influenza vaccines are available for seniors.
Now we have an adjuvanted vaccine to boost the immune response to the influenza component. So people aged 65 and older should get one of the 2 vaccines meant for seniors.
And Dr. Poland says don't underestimate influenza.
And it's really important that we take away from people the notion that it's, well, quote, just the flu.
So Liz, they mentioned adults over 65 needing maybe a little extra boost. Can you tell us why that is and what the difference is?
Definitely. What happens with adults is that the immune system is diminished or suppressed. So as you get 2 doses of the vaccination, then you will build more antibodies and prevent you from getting the influenza. So the CDC recommends that all adults 65 and older, that they actually get 2 vaccines to boost up that immunity and build adequate antibodies to fight the influenza.
Interesting. So how far apart should these, are they one right after the other? Should they wait a couple of months?
They get 1 dose. It is a higher dose of the actual influenza vaccine.
Okay. In the video, they mentioned two separate vaccines. Is that just?
It's because there's 2 available vaccines that those that are over 65 can obtain, but there is dosage of higher doses for those that are 65 that can be given as a one-time dose.
Okay. And as far as giving the vaccine, how many choices are there? Not everybody's crazy about getting a needle.
Well, yes, you're absolutely right. And last year they had some nasal vaccines, but we have to wait on the CDC. They let us know if these are adequate for immunization or for protection. So we found sometimes that these other alternative ways of receiving the vaccination might not be the most effective way to prevent us from getting influenza.
Okay, so if given the choice, your best choice is to go with the injectable?
Most of the time, the injectable would be the most appropriate to receive.
Okay, because I'm going to guess a lot of our audience members are wondering about that. They've heard about is it a nasal?
There was a nasal one available.
Okay.
And last night, the last year was not as effective.
Okay, and I guess they have studies showing that more people got sick after they took it than from the injectable.
That did not develop adequate immunity.
Okay, so we talked about everybody getting the flu vaccine. So let's get into a little bit more in the weeds as far as who everybody is. Let's say a cancer patient, maybe they're under chemotherapy or they've just finished it. Are they okay to take it, or should they be taking it as well?
So that kind of population, yes, it is very important. So we have folks that are immunocompromised, like cancer patients. It's very important for them to get the flu vaccine to protect themselves from the comorbidities or the different complications that influenza causes. So those populations, those over 65, cancer patients, those with pulmonary illness, those with cardiac illness, all of that population, the pregnant mom, it is very important that they protect themselves from influenza by taking a flu vaccine. Even with pregnant moms, they will transmit to their unborn child a degree of immunity when they take the vaccine. So as we spoke before, those that were less than 6 months old not being able to have adequate immunity built for that influenza disease, when a mother takes the influenza vaccine, it helps with the immunity of the unborn child. Also, we see that pregnant women will have alterations with their heart rate changes, the lungs, the way they function, and all of this will make them more propense to having influenza, so they do need to protect themselves.
Okay, so you covered the gamut there. So we got people over 65, we got children over the age of 6 months. If you're receiving any sort of treatment, if you have heart disease, even if you're a pregnant mom.
Yes.
And does it also protect the child after it's born, potentially, the vaccine?
Mothers do pass a degree of immunity, so when they get vaccinated and they build those antibodies, it will also pass to their unborn child when they are born.
Okay. So, big question. I know a lot of folks think that by getting the vaccine, you could get the flu. So can you kind of clear that up for us? What exactly are you receiving when you get the flu vaccine?
So a lot of folks feel, no, I'm not taking that influenza vaccine because I will get the flu. What happens as you are building immunities to the influenza and antibodies are built in your system, you will get certain symptoms that you might attribute it as influenza, but you cannot get the influenza disease or illness from a vaccination of influenza. You might get some soreness to the site, some tenderness, a little bit of malaise or under the weather. You're not feeling that well, but that's your body building the immunity to prevent you from getting influenza. And as we have spoken before, influenza is deadly. So that should not be a reason for you to abstain from getting a flu vaccine.
Oh, great information. So also, another concern that I hear a lot about is allergies. Now, despite all the information that's out there, people still believe that the vaccine can cause or aggravate some allergies. So we have fear of needles, I'm sure is a big one, and the other one's allergies. Can you address the allergy part, like eggs or anything like that?
Right. So yes, people talk a lot about influenza and having certain allergies and being the reason why they don't want to take the flu vaccine. So nowadays, the flu vaccine, we have availability of egg-free allergy for influenza, no eggs. We also have folks that said, no, the preservative or the thimerosal that was put into the vaccines caused me to have an allergic reaction. There's no longer thimerosal in many of these vaccines. Oh, I'm allergic to latex. That would be another thing that we don't have in our vaccines. So we've tried to really reach out to all of those fears that our population stated that caused them to refrain from getting a flu vaccine, because we know the importance of vaccination as the #1 prevention against influenza.
That's great information. So can you share with us, Liz, some of the other reasons why, I'm sure you've heard plenty, why someone wouldn't want to get a flu vaccine?
Most of the time they're scared of needles.
Okay.
That's usually what they'll say. I'm scared of needles. I don't want to get sick this weekend. So those would be the most that we listen to. We used to hear a lot about I'm allergic to eggs, but that doesn't happen that much anymore because we have available vaccines for that purpose.
Yeah, that's great. So if everybody did get vaccinated, is it possible that we could do away with the flu? I know it morphs into other, varieties of it, but There's something called herd immunization, where basically if everybody were to do this, we can really downplay the effects of it, or at least get rid of some of the strains of it. So in theory, if everybody got the flu vaccine, what are the chances that we get rid of the flu as we know it today?
So as we know it today, most likely we definitely can contain the influenza and prevent a lot of the pandemic, like what happened in the Spanish flu in 1918. As a matter of fact, they all were rushing, all the scientists and medical community was rushing to create the vaccine. And when they finally came up with something, it was then just for the military, because they were the ones in quarantine, in confinement environment, and they were the ones that we needed to have that vaccine sooner. So the same thing would happen as we vaccinate, then the amount of folks in population community that actually would get influenza will decrease. The more people get vaccinated, then less people would get influenza. Now, every year we must have a vaccine, because as we know, this virus that at first occurred in the Spanish flu in 1918 continues to mutate. It continues to change. So every year we need a new vaccine. We need something that shows us what is really out there creating influenza.
That's fascinating. Up next, registered nurse Felicia Jones joins us to go over the dangers of the influenza virus. And later in the show, we'll show you how to keep the germs away. You're watching the Health Channel, All Health All the Time on South Florida PBS. If you have a question for our experts, why not call in? Just use the toll-free number 855-796-4475. And please be sure to visit our website, allhealthtv.com, where you can watch videos from previous episodes. We'll be right back.
We all play a role in keeping our community safe.
Every day, we move in and out of each other's busy lives.
It's easy to take for granted all the little moments that make up our everyday.
Some are good, others not so much.
But that's life.
It's when something doesn't seem quite right that it's time to pay attention.
Because only you know what's not supposed to be in your everyday.
So protect your everyday.
If you see something suspicious, say something to local authorities.
Us lives here, where we can be surprised by others and ourselves. For a better us, support your local Y today.
Hi, this is Terry Bradshaw here to remind you that rheumatic diseases like rheumatoid arthritis and lupus are important to know about. If you're like me, you don't have time for flare-ups to slow you down. That's why I've taken the American College of Rheumatology's pledge to live well with rheumatic disease, and you should too. Things like eating healthy, staying active, not smoking, and managing my stress keep me going. Visit simpletask.org to take the pledge to live well.
Migraines are pulsating headaches that often occur on one side of the head. If you suffer from migraines, you're familiar with the throbbing, one-sided pain that makes you sensitive to light and noise and causes nausea or vomiting. Some home remedies for migraine pain include changing your diet, monitoring triggers, scalp massages, using an ice pack, anti-inflammatory herbs like peppermint or chamomile, and staying hydrated. Contact your primary care physician about treatment options available to you today.
Dear humans, I stand here today not for myself, but for every tail wagger, sloppy kisser, and curtain ninja. I stand here for each one of the nearly 4,100 dogs and cats killed in shelters each day, asking you to join our cause and help us make sure every best friend has a chance to meet one of their own. With Best Friends Animal Society leading the charge, and your help, we can save them all.
Welcome back to the Health Channel, All Health All the Time. I'm Henry Guzman, registered nurse and exercise physiologist with Baptist Health South Florida. We're talking about influenza with Elizabeth Reinhardt, an advanced registered nurse practitioner, and registered nurse Felicia Jones, both with Baptist Health. Thanks for joining us, Felicia.
Oh, I'm very happy to be here.
If you have a question about the flu or the vaccine, please call in using the toll-free number 855-796-4475. We would love to hear from you. When children get the flu, it's not always easy to figure out how sick they really are. The child can be too young to express themselves with words. Let's look at this video from the Centers for Disease Control and Prevention, and we'll talk about it afterwards.
There are emergency warning signs you'll want to know about. Anyone who has any of these signs should get medical care right away. Look for these flu emergency warning signs in children. Fast breathing or trouble breathing. Bluish skin color. Not drinking enough fluids. For example, the child is not going to the bathroom as much as normal or having significantly fewer wet diapers. Not waking up or not interacting. The child may be so irritable that he or she doesn't want to be held, or he or she may have flu-like symptoms that improve, but then return with fever and a worse cough.
Now, those seem like serious flu-like symptoms. Can a child still get the flu after they got the flu vaccine?
It's very possible, Henry, because there's so many different strains of and subtypes of viruses that it's very possible that although you got the flu shot, you may very well encounter the flu. Yeah. So a child can, as well as an adult, can get the flu, even with getting the flu shot.
And it's probably a lot harder with kids, you know, especially little kids. They just don't feel well. They're not sure what they're feeling. They're running a little temperature. They can't really express themselves. Correct. So let's take a look at some of the other complications. We've got a nice graphic here. Maybe we can chat about this, the graphics here. So we got bacterial pneumonia, and that's basically an infection of the lungs? Of
the lungs, yes.
Correct. And you want to talk us through some of the other ones, Felicia?
So ear infections, the child may have an ear infection based on some of the complications from the flu. They have a tendency to tug on the ears, or they're constantly rubbing at the ears. A sinus infection will be something where they're really stuffy and they just can't get cleared, and they just need a little assistance from the parents or an adult to help them clear from those complications. And then you'll see chronic worsening if someone is really sick, such as an elderly person, or if a child is very sick, they may have medical conditions that will cause more issues.
Yeah. So these complications, are they similar for adults?
Well, some of them are similar, particularly if there's medical conditions that cause it to be worsened. However, with children, the children don't express themselves very well, but an adult can tell you if they're not feeling well, or if they have such thing, they don't really get earaches. But children, because they're small and their sinus cavities may be smaller than adults, they may have the symptoms worse and may not be able to share it.
Right, that's incredible. That's the flu, which, as we discussed earlier, can have such serious complications. Again, yes. We know this stuff, but sometimes I don't think people really understand the dangers of it. We talked a little bit about the statistics of how many people actually die from the flu.
It is deadly.
So again, going back to vaccinations, how important is vaccination? So I know Baptist has a vaccination program for employees and family. Can you tell us a little bit about that, Felicia?
Yeah, Baptist has an incredible program where we are vaccinating approximately 18,000 folks in a short period of time. Our program basically runs from October 1st through November 16th, although the flu season goes throughout to March or April and May, and that depending on if it's CDC says that it needs to be continued because there's still viruses out there. But for Baptist, October 1st through November 16th is usually our vaccination period. And we vaccinate all of our adults who are able to get the flu shot and are willing to get the flu shot. We also have a program through our Urgent Care Express where we are now vaccinating dependent children of employees while vaccines last. And there's certain areas such as, I do believe we have three urgent care express centers where they can take the children to get those vaccines free of charge.
Wow, what a great program. So knowing how important the flu vaccine is, how do you get employees to take it? I know some people are scared. We spoke earlier about needles and about different fears. Now, knowing the information that we have, the history of the flu, how safe it is, I'm sure there are people that are still hesitant to take the vaccine. How does Baptist deal with this?
Well, Henry, one of the things that we did was educate, and educate. We educate our people through folks like Elizabeth, who runs an employee health office. We go out to talk to our employees to make sure they understand that they cannot get the flu from the flu shot. That's a big issue. And then we actually talked to them and found out why they were afraid. And then we explain what are some of the consequences of not getting the flu shot, because there's more options to have problems when you don't get the flu shot as opposed to getting the flu shot. So we have different types of vaccines that we can offer to our employees so that they have more than one choice if they are allergic to eggs or if they're greater than 65 plus, and even our vaccines are what we call quadrivalent. It covers more variety of viruses as opposed to some of the retail health areas. So we offer, I would say, a better selection of vaccines to our employees, and they understand that. And, you know, we actually have followed the process of the CDC guidelines, and we have seen a dramatic increase of vaccinations by our employees.
So there's some vaccines that have become almost mandatory, especially for before you start school, because we know how important they are, how they prevent a lot of the diseases that we saw the earlier part of our existence, right?
Yes.
Why isn't the flu vaccine, knowing how safe it is, knowing how much it could reduce the symptoms, if not, you know, get rid of possibly the flu or a lot of strains of it, why isn't it mandatory?
Well, Henry, in some cases across the United States, it is mandatory. It's in some states, such as, I would say, New York State and Texas, there are some states that have made it mandatory. In order for you to get your license to work, you have to, if you work in healthcare, you have to have a vaccination. Here in Florida, it's based on the organization, and most healthcare organizations have made it mandated to be mandatory. If you are working in clinical areas or if you work in a healthcare environment, you have to get the vaccination. You have to, you know, provide your arm and get the shot. So that's something that Baptist Health has. We have a mandatory program, but there are also options for those people who just cannot get the vaccination due to medical conditions or other ethical or religious beliefs that they should not get the vaccination. We do offer an alternative to getting the vaccination.
So you've educated the employees, told them, you know, how wonderful this works, how you can prevent some of the flu. I asked Liz last time in the earlier segment what kind of excuses she heard, and I'd love to hear, because I know sometimes there's some weird ones. If you've come across any weird reasons why someone wouldn't want the flu vaccine.
Oh, there are several reasons that people usually don't want the flu vaccination based on fear. But some use, again, their religious beliefs, and you know, if they belong to a certain church or a lifestyle that don't believe in vaccinations, that's an option for not getting the flu shot, but they have to sometimes demonstrate that. The other thing is that I've actually heard where someone thought they were getting chips put into their body. Like, of course, we're putting a chip into the person's body so that we can monitor their whereabouts.
You mean tracking chips?
Yeah, they thought it was tracking chips being inserted, something against the government, and that's just ludicrous because, of course, the vaccination does not have tracking chips. So that's something that we discuss and make sure people understand that that does not happen with the vaccinations.
Well, good, and I think we can unequivocally say that no, these vaccines don't have tracking chips in them, so you can You can rest assured nobody's tracking you.
You're right.
So Felicia, as far as getting the vaccine, is there a best time? I know we talked about when is the best time to get it from a seasonal standpoint. What if you're not feeling well to begin with?
Well, if you're not feeling well, we have another opportunity. We have plenty of opportunities to get the flu vaccine because you don't have to get it the first day we start offering, but we need to have it done before a certain time. And if someone doesn't feel well, we ask them to come back another time. If someone says that they're having some issues, we ask them to come back. If you're just not up to having the flu shot that day, it's not mandatory that you get it on a certain date and time. However, we want folks to get the vaccination usually at the peak of flu season. And this year, it's been put out that October is usually the best time to start getting the flu vaccine. And then, of course, October, November is usually the peak time that you want to make sure that you get vaccinated because you do have to build antibodies in your system and build up your immune system. And that's the perfect time to go ahead and get the flu shot around that October, November period.
And does Baptist offer the flu vaccine to the community at large or just to employees or how?
Well, currently we offer to our employees, our volunteer program that we have throughout the system. We also offer to our medical staff, whether they're employees or non-employee, our medical staff, which include our PAs, our doctors, and anyone who's on the medical staff. And then we offer to our dependents, again, to our dependents who are of employees while we have supplies. This is something new that we're doing this year that we're offering to that part of the community, and we hopefully next year and in the near future we'll be offering to the community at large.
That's great. Is there a cost?
It's free. It's absolutely free.
Okay.
There is no charge to our employees or our volunteers or anyone that I just mentioned, the groups that I just mentioned. It's free of charge. Whether someone can go to retail, they may have to pay with their insurance or pay out of pocket. With Baptist Health, it is absolutely at no cost.
Is there any place that you can recommend for the community to go if they can't get it here yet?
Well, yeah, there's several locations. In most cases, if the community, if you have insurance, of course, you can go to your primary care physician, or you could go to some of the clinics that's in the community, or we have Publix, we have retail pharmacies such as CVS and Walgreens. All those organizations offer the vaccination. While their vaccination is probably a trivalent, which covers a certain amount of viruses, it's still available and it's still at a low cost.
Great. That's great information, but don't go anywhere because up next we have tips to prevent the flu. You're watching the Health Channel, all health all the time on South Florida PBS. If you have a question for our experts, please call in using the toll-free number 855-796-4475. And please be sure to visit our website, allhealthtv.com, where you can watch videos from previous episodes. We'll be right back.
Cancer. We don't want to think about it, but I had to. Because you see, I was traveling, I was enjoying life, I was working. It was too long since my last PAP. When I was finally tested, we thought I might have cervical cancer. After worrying, no cancer. I was lucky. Women, please get a Pap test to check for cervical cancer and get the inside knowledge about gynecologic cancers for you and the people who care about you.
T-cell therapy is a revolutionary new treatment for cancer. Healthcare companies developing CAR-T immunotherapy use Thermo Fisher's Dynabeads technology to isolate, activate, and expand T-cells that have been genetically engineered to recognize and fight cancer cells.
We're taking the patient's own cells and enriching those cells to fight the cancer.
For more, go to thermofisher.com/CTS.
Each year, an estimated 12,000 women are diagnosed with cervical cancer. Thanks to improved screening and vaccination, cervical cancer is a highly preventable and treatable cancer. Early detection is key. Women should pay close attention to their cervical health by following these guidelines. Start testing at age 21. Women between ages 21 and 29 should have a Pap test done every 3 years. Women between the ages of 30 and 65 should have a Pap test plus an HPV test done every 5 years. A woman who has been vaccinated against HPV should still follow the screening recommendations for her age group. Your particular health history may dictate a different screening schedule for cervical cancer. Contact your primary care physician to talk about your history and schedule your next screening today.
Welcome back to the Health Channel, all health, all the time. I'm Henry Guzman, registered nurse and exercise physiologist with Baptist Health, South Florida. We're talking about how to prevent the flu with Elizabeth Reinhardt, an advanced registered nurse practitioner, and registered nurse Felicia Jones, both with Baptist Hospital. If you have a question for our experts on the flu or pneumonia, give us a call on our toll-free number, 855-796-4475. We would love to hear from you. How important is it for our family members and caregivers to get flu vaccines? We've been talking this hour about how vaccines can prevent or decrease the risk of getting the flu and pneumonia. But there is still something all of us can do to prevent spreading germs. But are we doing it correctly? Let's find out.
Children are often taught at a young age to wash their hands before eating and after using the restroom. It's an easy and effective way to stay healthy and avoid spreading disease. But Dr. Gregory Poland, director of Mayo Clinic's Vaccine Research Group, says adults could do much better at the sink.
People go to the bathroom and they run their fingers under the water. Well, that does nothing. And then they grab the dirty faucet and they touch the dirty handle on the way out of the bathroom.
Dr. Poland says that in public washrooms, there are often more bacteria on those faucets than in the toilet water. So next time you're at the sink,
so you wash your hands while singing happy birthday to yourself. You get between the fingers, the fingertips, the thumb. You turn the water off with a paper towel, and you open the door to leave with a paper towel and dispose of the paper towel. That's how you wash your hands, ideally with warm, soapy water.
Great tips. Let's review the other ways to prevent the flu. We've got a nice graphic we're going to put up on the screen right now. So flu prevention. Ladies, anyone?
Yes, so Henry, as we talked before, the most important and effective way to actually prevent the flu is getting your flu vaccine every year. But also covering your cough and your sneezes, and definitely we don't want to do this with our hands. We want to make sure that we use a tissue that we can discard. And staying away from those who are sick and our loved ones to protect them. And as we saw in that segment, frequent hand washing. Actually, 30 seconds is what is recommended for you to wash your hands. You can have a song not only of the happy birthday sung twice, but you could also recite your ABCs. And that will give you the 30 seconds that you need to wash your hands with soap and water. If you don't have the soap and water nearby, then obviously we see the gels and the different type of hand sanitizers that we can use. But just like that study reminded us that folks touch their face 16 times in 1 hour, and that some of them, if you have the influenza and you're touching your nose and you're touching your mouth and then you're touching your family and a surface, then you increase the likelihood of transmitting that influenza. Therefore, washing your hands is most important and after getting your flu vaccine.
So great tips there, and one in particular that stuck out was the singing "Happy Birthday" twice, or the ABCs, just going through the alphabet. So I was actually at a restaurant, and I was in the restroom washing my hands, and they had the ABC song in the background, almost, I guess, encouraging you to sing along so you get the full 30 seconds in. So one of the things that they talked about as far as prevention was when you cough or sneeze. So obviously when you're sick, you're constantly coughing, sneezing. What is the best way to do this to try to prevent as much of the virus from spreading?
So coughing and sneezing should be done into your sleeves.
Yes.
So that you prevent from this to travel. As we know from that other study, 6 feet is enough to propel the droplets and the germs and the particles of influenza. So cough into your sleeves, and sneeze into your sleeves.
Okay, what if you're wearing a short sleeve shirt?
Then cough into a tissue. Cough into a tissue and discard your tissue.
So the idea is just try to, in a downward motion, and try not to just spread it directly at people.
That is correct.
Traveling at 50 miles an hour, infecting everything within 6 feet. 6 feet of you.
Yes.
So another great tip that we saw was staying away from sick people. Now, for the average working adult who's got a 9 to 5 and they're not feeling well, they call in sick. At what point should they come back? Because I know a lot of people at work and co-workers, they come back, they're still sneezing and sniffling a little bit, and they say they feel fine, which I'm sure they do, but is that virus still active? Can you still infect people? And what's the best time to give yourself?
Well, Henry, as you know, we do have people who come to work sick. They feel they can make it through the day, but it shows that they are very sick and they should stay home. And if you're sick and you don't feel well, you're running temperatures, you have a cough, you're sneezing, you're congested, the suggestion is that you do not come to work, because you can infect not only your family members, you infect your coworkers and your patients or whomever you're taking care of, and you just make the community sicker by you being out. So the suggestion is that folks stay home and they make sure that they don't have a temperature when they come back to work. They should be at least afebrile or no fever for at least 24 hours. They should have minimal cough or no cough and sneezing. And they should have already seen a doctor. They just shouldn't just say, okay, I feel better and I'm going to go back to work. No, you really should see a healthcare professional before returning to work if you are, because you can have a relapse and you can get sicker, which will eat away on your vacation time as well as making your community sicker. So it's best if you stay home until you actually feel better and you've actually gone to a healthcare professional and you have taken precautions to take care of yourself.
So ideally, for the sake of your own health and for your coworkers, you should probably go see your doc first.
You should,
because they can do a test, right, to see if you still have it. Can they swab or something like that to see if you're free from the flu?
Yes, you can do a test, and there's medication that can be given to you specifically for the flu. And if the person don't go, they'll never get rid of the flu virus. It just stays there and lingers and can cause other issues. Bronchitis, pneumonia, other chronic illnesses can occur. So it's best if the person goes to see the primary care physician or any healthcare provider who could prescribe medication for them to get better.
Right, and I think the incubation period was about, was it 5 days?
Yes.
5 to 7 days total? So that's kind of a good litmus test from the onset. So that from the onset of feeling not well, you've probably contracted it a day or two before.
Correct.
Right, because you don't feel
and
it
you
right
shed
away.
that virus for a week.
Right.
So it is important for you to stay away from those that you can cause an exposure to, at least for those 5 days that you're shedding the virus. And like Felicia was saying, you must be free of a temperature for 24 hours. That means you didn't take Tylenol or anything else to decrease that temperature. You actually were no fever for 24 hours.
So a good time frame just for our viewers to kind of get an idea. So once you start feeling well, let's say you start feeling well after 2 days of getting the symptoms, you should probably give yourself another day or two.
You should, because it's important to have the proper rest as well. You know, you just because you're feeling better does not mean that you should automatically come back to work or try to work, because it doesn't mean that the virus is gone. It's still there in your system, and you need to give yourself at least, I would say, at least 5 to 7 days in making sure that you have no temperature and that you're well rested, and that you're not taking medication to assist you to get back to work. So you shouldn't come back to work if you're loading up on Tylenols, like Liz says, because without the Tylenol, you would be very ill.
That's great advice. It's almost like being at home. Usually, if one person gets sick at home, everybody gets sick.
Correct.
The doorknobs, the faucets, everything gets infected. So work is usually like your second family. Yeah. You don't want to get them sick, right? So
that's correct.
Stay at home and take care of yourself. That's all the time we have for today, but thank you for joining us. Be sure to join us next time on the Health Channel, All Health, all the time on South Florida PBS. Follow us on social media at All Health TV, where you can get health tips from our experts and see what's coming up on the Health Channel. We can also visit our website, allhealthtv.com, to watch videos from previous episodes or submit questions for the experts. I'm Henry Guzman. See you next time.